Well, we're moving on now. We'll bring to you more updates. It's a developing story. Definitely, we will be speaking with our correspondents, and most importantly, we'll give you updates and feedback here on News Central. Moving away from that story now, the Gauteng Department of Health, GDoH, has shut down Tembisa Hospital and advised members of the public who need to access healthcare services at Tembisa Hospital to visit other health facilities, as the hospital remains inaccessible after a police officer allegedly shot and killed his 30-year-old partner, a nursing assistant, at the facility parking lot. Let's now bring in William Els, a senior training coordinator on terrorism at the Institute of Security Studies, for more update on that incident in South Africa. Thank you so much for being here with us this morning. What do we know about the 30-year-old policeman who was responsible for this shooting, and what were his intentions?
Good morning to you. Yes, according to our information, it was a 30-year-old police officer that was actually on duty when he went to the hospital in an official vehicle. We also understand that the strobe lights or the flashlights were on, and he managed to get through the security gates using that vehicle with the emergency lights flashing. And then he called his friend out from the hospital where she was working, and then what seems to be domestic violence incident, he actually shot and killed her. She died on the scene, and then he turned the gun on himself. All indications are also that this gun that was used is also an official firearm issued by the police that was used.
Now, Willem, you are a senior coordinator at ISS. When incidents like this happen, what is the first point of call in terms of tackling? How do you manage it? How do you handle the situation?
Well, and thank you for that. In the first instance, it's a crime scene. It's a violent crime that's taken place at a place where people go for refuge. So that was very traumatic for the people that went to the hospital, and they have been referred to other hospitals. Just to put in perspective, this hospital, those of you who have been to South Africa, is just a few kilometers from the OR Tambo International Airport near Johannesburg. So what happened then is this crime scene needs to be investigated. The police cordoned off the area. Unfortunately, it was very close to the entrance of the emergency treatment for patients. So what happened was they had to refer these incoming patients to other hospitals.
All right, we also hear that the deceased and the shooter were romantically involved. But how true is this?
According to the statement from the police spokesperson, that is the case, yes.
All right, now the Domestic Nursing Organization of South Africa, that's the DENOSA, wants the health department to challenge and even reconsider the law that allows police officials to enter health premises with your gun. Now, unless the situation is of an extraordinary nature, is this something you think can fly the first or even second reading in Parliament?
It certainly has to be investigated. You see, you sit with a predicament where in an emergency situation, using an emergency vehicle, being from the emergency services, normally access is then granted. If this police officer get to a boom gate where the security is there and the perimeter security and the lights are flashing, normally these people just open up, because remember, we have to trust the police, we have to trust the emergency service. They're coming to an emergency institution where they treat people. So that makes it a very difficult call. They will have to look at protocols, they will have to look at training, and they also have to look at policies in how to facilitate this very difficult situation.
All right, let me just take you on one more question quickly. How's the atmosphere right now? We saw footages of nurses, possibly her colleagues, how they were actually shocked, shell-shocked and walking around. Also, her remains were taken off, and people are still shocked, right? What's the atmosphere like currently?
Well, currently it is stabilized because this incident happened yesterday, so they started to stabilize. What they also did is they brought in some help for the staff. The trauma counseling was done. You must understand that a situation like this is very, very similar to a terror situation where they use these type of shock tactics to scare people, and for these staff and colleagues to have observed what happened, it must have been very traumatic for them, and that therefore what the health department has done, they brought in the trauma counseling for these people, and they are looking after them.
All right, we also understand that investigation is underway, and we'll be looking forward to more updates from you, William L., Senior Training Coordinator on Terrorism at the Institute of Security Studies. Thank you so much for joining us on the program.